And as we know, CHIP works. Studies have shown and have proved that enrollment in CHIP improves the health of children. When previously uninsured children signed up for CHIP, they are far more likely to get regular primary medical and dental care. They are less likely to visit the emergency room for services that could be rendered in a doctor's office. That saves us health care dollars. They're more likely to receive immunization and other services they need to stay healthy and lead a healthier schools and communities. They're more likely to get the prescription drugs they need to recover from illness. The best evidence of CHIP's success doesn't rest in studies or surveys, it rests in the families themselves. The Bedford family from Baltimore is a success story, one of millions of the families that are in CHIP. Craig and Kim Lee Bedford and their 5 children have testified here on Capitol Hill about the differences that the Maryland CHIP program has made in their lives. Mrs. Bedford said, perhaps the greatest impact the Maryland Children's Health Insurance Program has had on our family is that we no longer have to make the impossible health choice based on a financial perspective. We no longer have to decide whether a child is really sick enough to warrant a doctor's visit. We no longer have to decide whether a child really needs a certain medication prescribed by his pediatrician. Mr. Bedford said, the face of CHIP is families such as ours, families that work hard, play by the rules, trying to live the American dream. So for the Bedford family and millions more, CHIP has been a success, but there are still millions of children who have not enrolled in a program offered by their states. Our state are making progress, simplifying their enrollment procedures, expanding outreach efforts, and using joint applications for Medicaid and CHIP so that families can enroll together. The states are making progress. But as we reauthorize the Children's Health Insurance Program, let's make sure that we make real progress. Our bill will extend the program for 4.5 years and allow an additional 4.1 million children nationwide to enroll. Mr. President, 4.1 million children. We've got to get this bill done. I want to talk about the MCHIP program, the Maryland State program. It has one of the highest income eligibility thresholds in the nation. I know my colleagues have talked about this. And this is needed because of the high cost of living in our state. Eligibility is 300% of the federal poverty level, not because our governor wants to move people from private insurance to public insurance plans. It is at 300% because working families at this income level do not have access to affordable health insurance. That's the statistics of my state. Those families need CHIP. And by the way, this is a state option. One of the points that my friend from Utah mentioned, I don't think the federal government should be prescriptive. Allow our states to figure out what program works best. There are incentives to cover the low-income families. There are higher matches from the federal government, as it should be. We should make sure that the lower-income families are covered first, and we do under the CHIP program. Children under the age of 19 may be eligible for MCHIP if their family income is at or below 200% of the federal poverty level, or up to $34,000 for a family of 3. Our program has been a true success. Enrollment has grown from about 38,000 enrollees in 1999 to more than 100,000 today. In my state of Maryland, the needs have exceeded the available funds. We actually spend more money than the federal government will allow us give us. The federal match through the CHIP formula established in 1997 is not enough to meet all the costs of the MCHIP program. Some states do not use their entire allotment, while other states like Maryland have expenditures that exceed their allotments. Congress has addressed this problem by redistributing the excess of the states that have excesses to the states that have shortfalls. Now we must move forward for future years. This is what we are doing on the floor of the Senate today, and I want to thank Chairman Baucus and Senator Rockefeller for their efforts on this bill. This bill will allow us to continue to cover children and families with incomes up to 300% of poverty. Maryland would also have access to contingent funds if a shortfall arises and additional funds based on enrollment gains. With this new money, Maryland can cover an estimated 42,800 children who are currently uninsured over the next 5 years. There's another important part of this bill I want to talk about for a moment, if I might, Mr. President. Section 501. It hasn't gotten much attention on the floor, but certainly has gotten a lot of attention around the country. And that ensures that dental care is guaranteed benefit in CHIP, a guaranteed benefit. I agree with my friend from Utah, we need to set standards at the national level. and dental benefits must be included. According to the American Academy of Pediatric Dentistry, dental decay is the most common chronic childhood disease among children in the United States. It affects 1 in 5 children between the ages of 2 and 4, and half of the children between the ages of 6 and 8. Children living in poverty suffer twice as much tooth decay as middle and upper income children. Nearly 40% of black children have untreated tooth decay in their permanent teeth. More than 10% of the nation's rural population has never visited a dentist, and more than 25 million people live in areas that lack adequate dental services. Next month will mark the 2 years since a young man from suburban Maryland named DeMonte Driver passed away. DeMonte Driver lived in my state of Maryland. He was 12 years old. He died in February of 2007 from an untreated tooth abscess. His mom tried to access the system, tried to get him to a dentist. What was needed was an $80 tooth extraction. Because of the failure of the system to cover his services, and an inability to get to a dentist, he ended up in an emergency room. $250,000 was spent in emergency surgeries, and he lost his life in the United States of America in 2007. Well, this bill will do something about it by covering oral health care as it should. His death has showed us that C. Everett Koop once said, "There's no health without oral health." No children should ever go without dental care. I've said before that I hope that DeMonte Driver's death will serve as a wake-up call for Congress. Mr. President, Section 501 of this bill shows that it has. We must never forget that behind all the data and enrollment and behind every CBO estimate, there are real children who need care. When I spoke about DeMonte Driver after his death, I urged my colleagues to ensure that the CHIP reauthorization bill we send to the President includes guaranteed dental coverage. This bill does include guaranteed dental coverage. It also provides ways in which families will have a better understanding of the need for oral health care. It also provides ways in which families can access dentists who will treat them under either the CHIP program or the Medicaid program. This is a major step forward on dental care. We need to do more, and I just want to acknowledge the work, particularly of Senator Bingaman and Snowe, on oral health care. They've been real champions of this body in moving forward on these types of legislation. This bill will also require GAO to study and report on access to dental services by children in underserved areas, access to oral health care through Medicaid and CHIP, and how we can use mid-level dental health providers in coordination with dentists to improve access to dental care for children. Results of the study will give us the information we need to further improve coverage. We still have to raise reimbursement for dental providers and send grants to the states to allow them to offer wraparound coverage for those who have basic health insurance but no dental insurance. But these provisions are an excellent start. Mr. President, after 2 vetoes of a bipartisan CHIP bill by the former president, I am so pleased to stand here today on the floor of the Senate and express my strong support for S-275. This is the week in which we can make progress on covering people in this country, particularly our children, with health insurance. 1 week after the inauguration of President Obama, we are poised to move this bill through the Congress and to his desk so that it can finally become law. I urge all my colleagues to vote in favor of this legislation as we start down the path to universal health coverage for all Americans.